Heute spreche ich mit Professor Dr. Jörg
Today I'm talking to Professor George Birkmayer about the effect of NADH on cancer. But what exactly is NADH? NADH is the biological form of hydrogen. The more of it the cells in our body have, the more energy they produce, allowing them to live longer and function more efficiently. However, in order to give our body more of this natural fuel for cellular energy production, it needs to be administered in a specially stabilized form. Professor George Birkmayer has succeeded in doing this as a result of decades of research. The Austrian scientist is regarded as a leading international expert in NADH. The effect of his NADH formulation has been proven in numerous studies, and the researcher enjoys a worldwide reputation in oncology, neurology, and anti-aging medicine, with his guest professorships and lecturing activities in North America, Europe, and Asia. Professor Birkmayer, hello, good morning. Hello, Ms. Renneberg. How does cancer actually develop? Well, by changing the DNA of the genetic material. The DNA in our cells can be damaged by many different influences, including environmental toxins, pesticides, smoking, drugs, chemotherapeutics, heavy metals such as mercury in amalgam fillings, UV light, and radioactive radiation. These factors produce free radicals, and the free radicals are highly reactive molecules that alter our genetic material and thus provide the basis for the development of cancer cells. Most mutated cancer cells have less ATP than healthy cells due to damage to the mitochondria, the power plants of the cells. Therefore, most cancer cells do not have enough ATP, which is why they are unable to synthesize all components of the cells, especially not those that the cells need for controlled cell division. One of the characteristic features of cancer cells is uncontrollable cell division. Professor Mikarova in the USA has demonstrated a deficit of NADH in more than 100 tissue samples of cancer cells. This means that these types of cancer have too little ATP. For me, this is the biochemical cause why cancer cells divide uncontrollably and subsequently form metastases. And this typical property of cancer cells is due to missing receptors on the surface of the cells, which are responsible for communication between cells. Cancer cells proliferate because they ignore their neighboring cells. Normal cells recognize their neighbors and behave accordingly. In other words, they do not displace them. My personal theory is that the administration of NADH increases the level of ATP, i.e., the energy in the cancer cells. What effect does NADH have on cancer? Well, the ATP level can be increased by NADH. We have proven this. We have proven this in isolated cells. However, the oxidized form of NAD+ as well as the precursor niacin do not lead to an increase in ATP levels, and administering NADH also causes the ATP level in the cancer cells to increase, which restarts synthesis of the regulation molecules in the cancer cells and stops the uncontrolled cell division. After we were able to prove that NADH increases ATP levels, it was obvious to use NADH in cancer patients. The well-known American physician, Dr. Tom Cowan, describes in Chapter 10 of his book, Cancer and the New Biology of Water, why the form of NADH I have developed and patented is effective in cancer. His explanation: NADH delivers the hydrogen into the cells, which reacts with oxygen to produce ATP, energy, and water. Michael de Forest of the University in Warbeck, England, also draws an analogous conclusion about the positive effect of NADH in cancer, And Dr. Richard Passwater writes in his foreword to my book, NADH, the energizing coenzyme, there is no substance in the human organism that could be described as the most important or the best biological antioxidant. But NADH comes closer to this definition than any other biological substance. So NADH is the strongest biological antioxidant and thus the best for neutralizing free radicals. So you can actually use NADH effectively for prevention, can you? Yes, that's right. NADH has a fourfold protective function in cancer. NADH repairs the damaged DNA. NADH is the most important factor in the repair of DNA, and as the strongest biological antioxidant, NADH neutralizes free radicals and other pollutants, and increases the ATP energy in the cancer cell. This allows the cell to form all components necessary for cell division again. If an ATP deficiency is actually one of the causes of the emergence of cancer cells, the question arises of how the ATP deficit in cancer cells can be eliminated. The ATP can be increased by NADH. We have shown this scientifically in isolated cells, and that was the reason why we then used NADH to treat cancer patients. I can just give you a few examples, briefly describe some patients, so that you can see how successful and effective NADH is. I remember a 48-year-old man with small cell lung cancer. This tumor, the size of a tennis ball, was diagnosed in September 2001 by means of computer tomography and biopsy. Due to the localization, the tumor, which was situated close to the heart, could not be operated on. The patient took 80 milligrams of NADH. 4 months later, the tumor had shrunk significantly, and after 10 months was no longer visible in an MRI, magnetic resonance imaging scan. I should mention that before he came to me, the patient received 15 cycles of chemotherapy and 10 sessions of radiotherapy that had absolutely no effect on the tumor at all. The patient has been healthy since May 2002, i.e. for 18 years, and confirms this to me every year by sending me a nice Christmas card. The second patient is a 63-year-old woman with breast cancer and liver and bone metastases. She came to me in 1998, and on my recommendation took 80 milligrams of NADH daily. After 3 months, a regression of the metastases was detected in the CT scan, and after 2 years, all tumor markers in the blood were normal, and the patient was healthy, and still is today. A third patient is a man with a prostate cancer who came to me in 1994. I recommended he take 6 tablets of NADH of 20 milligrams each, making a total of 120 milligrams of NADH. 6 months after taking NADH, the PSA value dropped from 35 to a normal value of 2.5. After that, no tumor could be detected, either under ultrasound or CT. And the last patient I'd like to mention here is a phenomenon for me, simply impressive. A 42-year-old, i.e. a young patient, from Algeria, has a 3.5 centimeter medulloblastoma, which is a tumor in the cerebellum, which was diagnosed by CT on the 3rd of August 2013. As a result, he was paralyzed in his arms and legs and wheelchair-bound. The patient could not be operated on because of the localization. The patient refused chemotherapy because he was not convinced of the effect. After a daily intake of 160 milligrams, the medulloblastoma was no longer evident on the 28th of November 2013, i.e. 3 months later. The paralysis had disappeared, and the patient had become healthy and remains so today after more than 6 years. Since 1989, I have treated more than 100 cancer patients with NADH. Many have become fully healthy. The tumor has stopped growing in the rest. You can find out more about this topic in my book, NADH, the biological hydrogen, the secret of our life energy. That's all I can say about NADH and cancer. These are very touching stories which prove that NADH can be combined with other forms of therapy. Thank you very much for the conversation. I wish you all the best. Thank you, Ms. Renneberg.